So now we're going to look at the effects and benefits of exercise to the respiratory system over the long term. So what are the adaptations? We have an increased number of alveoli, increased strength of the intercostal muscles, increased strength of the diaphragm, increased tidal volume, increased vital capacity. So why are these of benefit? More opportunity for gaseous exchange to occur in the alveoli, more oxygen from the alveoli to the blood, and more carbon dioxide removal. Increased muscle efficiency means more space created for the lungs to fully inflate, an overall increase in lung volume so you can take more air in and extract more oxygen more efficiently, and therefore as a result of regular training, more air can be breathed in, more oxygen can be extracted to the muscles so they can be used to produce more energy. So the next one we're going to look at is the benefits to the skeletal system, your bones, exercise and health. So with weight bearing activities, these lead to an increased bone density. With an increased bone density means stronger bones. Stronger bones means less chance of breaks, fractures and osteoporosis. The impact of long-term training is that with regular exercise leading to stronger ligaments and tendons, better support of joints to increase stability. More stability means less likely to dislocate a joint, less likely to get an overuse injury. The golden rule for this system is remember to break down your thoughts into clear stages. The effects, what happens, the benefit, so how this helps a performer, and the impact upon performance. The benefits of regular exercise, aerobic exercise to the cardiovascular system are that it reduces the chance of stroke, reduces the chance of coronary heart disease, and reduces the chance of type 2 diabetes. So what are the adaptations? We have an increased elasticity of the muscular wall and veins of the arteries, an increase in size and strength of the heart, so we have cardiac hypertrophy, an increase in resting stroke volume. So how do they benefit the performer? They drop resting blood pressure. They're good for health as it reduces the chance of coronary heart disease. Good for fitness as the heart can contract more forcefully. And more blood is ejected from the heart at each beat at rest, so the heart does not need to beat as quickly to supply the oxygen to the muscles. So there are 3 golden rules that you need to make sure when you're looking at the cardiovascular system. Regular means more than once a week over a number of weeks. It takes time for adaptations to take place, and reversibility will occur if the activity reduces or stops. Adequate rest periods are essential to allow these adaptations to occur. Golden rule number 2 is that you must make sure you say resting when you're referring to the adaptations of stroke volume. So adaptations occur over a long period of time, must not be confused with immediate effects. More blood is pumped out of the heart per beat due to the increased demands for oxygen. Golden rule number 3. Make sure you say resting when referring to adaptations to the blood pressure. A drop in blood pressure in general is not a long-term benefit. So there are also other adaptations to the cardiovascular system over the long term. The adaptations are: you lower your resting heart rate, you increase maximum cardiac output during exercise, you increase capillarization, you increase the number of red blood cells, and there is a faster return to resting heart rate. So why are these of benefit? The benefits of these adaptations are greater training zone. With an increased stroke volume, the heart needs to beat less often to eject the same amount of blood. Increased ability to carry oxygen to the working muscles, and an increased rate of removal of carbon dioxide. And finally, more efficient recovery after exercise. So the final one I'm going to look at is the adaptations to the muscular system. The effects and benefits of aerobic adaptations include hypertrophy of the slow twitch muscle fibers, increased myoglobin content, increased size of mitochondria, so therefore an increased number of mitochondria in the cells, The effects and benefits of anaerobic adaptations include hypertrophy of the fast-twitch muscle fibers, increased strength, and increased tolerance to lactic acid. Remember, the key terms that you need to know are anaerobic, aerobic, hypertrophy, myoglobin, and mitochondria.